I'm Dr. Mark Eccleston-Turrner. I'm a senior lecturer in global health law at GHSM, and my research looks a lot at the legal and political and international relations responses to infectious disease outbreaks. So I work quite a lot on things like pandemic preparedness and law and access to medical countermeasures, particularly in low-income settings. I'm the program director for our postgraduate degree, which is in global health, social justice and public policy. And I also teach on that degree where I teach the politics of health and medicine, which is a really interesting interdisciplinary module, which looks at the sort of the governance, the international relations, some history and some sociology. So we look at things like infectious diseases, but also communicable diseases through things like the Framework Convention on Tobacco Control. We look at quite a bit at security and securitization of disease at the international level. And then to the undergraduates, I teach values, ethics, and global health, which is a really interesting module that looks at the sort of like underlying philosophy or ethics of global health responses. So thinking about why we do global health, what are our obligations here, quite a bit around research ethics and good research conduct, particularly research which is conducted in the global south. And I also supervise dissertations for undergraduate, postgraduate students and have some PhD students in the department as well. I focus on the extent to which law and governance frameworks surrounding global health, so things like the World Health Organization, the ongoing negotiations of the Pandemic Treaty, which are happening in WHO, which I'm involved in, to what extent they can facilitate justice within global health. Because one thing that we've seen across COVID-19 most recently, but across numerous outbreaks, is that there's this huge inequity, this huge injustice, particularly in capacity to respond to outbreaks, but also in access to resources and countermeasures during a pandemic. And I work on how law can improve that, and to what extent law can improve those things. So it was actually during my master's degree, which feels like a very long time ago now. I did a class on international health law. And as part of that, I wrote my paper on vaccine inequity during the 2009 H1N1 outbreak. And then became fascinated by this area, particularly with regards to access to emergency vaccines during an emergency in low-income settings. The most fundamental question that can be asked in terms of my field of research is, to what extent can the current international system as we know it actually facilitate justice? There's a whole strain of research which is called TWAIL, which is Third World Approaches to International Law, who question the very idea of these sort of like governance systems as being effectively able to respond to the needs of the global south. And we see that in global health and pandemic preparedness, but we're also seeing that in areas like climate change.